Ectropion after blepharoplasty. I had an upper and lower blepharoplasty in March 2014. I immediately developed ectropion on my left lower lid. I have since had 2 revisions, the first with the original surgeon, the second with his partner. Both failed. Do I have any hope of getting this corrected? Attached picture was taken today. I want to go back to the surgeon, but I have become disheartened based on the previous revision failures, and I am afraid of making it worse.
Thank you for your question. You've submitted a single photo, and in the narration of your question, you describe a situation where you underwent upper and lower eyelid surgery in 2014. You had immediately developed an ectropion, or the eyelid turning away from the eye. And then you underwent 2 revision surgeries, one by the original surgeon and one by the surgeon's partner. And you remain in a situation where you still have ectropion, and you're asking if this can be corrected. Well, I can certainly give you a lot of guidance on this question. A little bit of background. I'm a board-certified cosmetic surgeon, fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and revisional eyelid surgery is one of the major areas of my practice for which people come to me from around the world. And one of the most common problems I deal with is a problem exactly like yours. So I'm going to give you a little bit of a framework as to the basis of why you are in this situation at this point and what can be done for someone like yourself when I see people like you in my practice. So to understand lower eyelid surgery and lower eyelid position, we always have to go back to some basic anatomical facts. And this has to do with the lower eyelid, which can be deceptively complex. First of all, the lower eyelid in many ways is like a suspension bridge. And so there is critical elements that keep the suspension bridge up. There's the tendons that attach to the muscle. There's the balance of the skin in the front and the back, as well as the tissue that's in between the skin and what is called the conjunctiva, the back of the eyelid, that is part of the support system. And the support is like pillars. Very often, when lower eyelid blepharoplasty is performed, for example, when it's done from the outside and the fat is removed, this system of support is compromised. In addition, when skin is removed in the effort to reduce and improve wrinkles, then there's actually a skin shortage. So, in your situation, without a physical examination, I think we can fairly reasonably conclude that there's opportunity to restore the anatomy in a way that will restore the position of the lower eyelid. It's critically important that lower eyelid position be restored because it's not just about the aesthetics, it's also about the health of the eyes. Proper eye function requires the continuous lubrication of the surface of the eye with tears. When the eyelid is everted away, well then that natural distribution of the tears is compromised. So certainly there are options to help you improve your outcome. It is still about restoration of anatomy. So I think what you need to do, and with due respect to the doctors who were involved in trying to help you improve your appearance, you may want to consider getting an additional opinion by a oculofacial plastic surgeon who does a lot of revisional surgery. You know, many years ago in my practice, you know, this decision to focus on a lot of focused cosmetic, oculofacial, and facial aging issues, it really is almost a specialty within oculoplastic surgery from my perspective and the way I work. We have to address always not only the medical issue of getting the eyelid in place, but also the cosmetic issue of optimizing a result so that it looks very good. And so there's often the combination of technologies applied, whether it's lasers, whether it's platelet-rich plasma, whether it's regenerative medicine. So I think it's important for you to not only really be comfortable with a doctor who's going to offer to help you with this procedure, who is a revision specialist, but understand that you do have hope, that there is something that can be done. It's not going to be a short journey, but it will likely ultimately lead to a better outcome than what you've been dealing with now for a couple of years. So I hope that was helpful. I wish you the best of luck, and thank you for your question.